Thanks, Teresa. And yes, this session will be recorded, so feel free to watch it later as well. Welcome everyone, and thank you for joining today's webinar. My name is Lucy, and I'm presenting on behalf of the BCG collaboration team, which, as Teresa mentioned, has been working with California counties now for almost a year. I also have my teammates Naomi and Patrick here. They'll be monitoring the chat and supporting. So feel free as we go to put questions in the chat. We'll also reserve some time at the end for live
Sorry,
Q&A.
Lucy, is your I think your audio might be cutting out. I'm not hearing anything. I don't know if I'm the only one.
I can hear you, Lucy.
Oh, okay. Patrick, can you hear me too?
Yeah, I can hear you on my end.
Okay. It looks like folks
Okay.
can hear me. So if anyone can't besides Teresa, please do let me know and I'll.
Yes, jump in the chat and then we'll try to troubleshoot. Sounds great.
Okay, awesome. Thanks all. So if we go to the next slide, today we'll move through 5 sections, starting with the claiming landscape and key concepts, then the why behind this focus area, how to actually stand up and strengthen claiming, and then common pitfalls to avoid. And then, like I said, we'll open it up for some live Q&A at the end, but please throw questions in chat as we go as well. And so by the end of today, we want you to walk away with 3 things. 1, a clear understanding of what admin and QA/UR claiming is and why counties are potentially leaving federal dollars on the table. Then 2, a practical understanding of the key steps to stand up or strengthen your claiming. And finally, 3, we really want you to feel like you're walking away with some concrete actions that you can bring back to your team to start better claiming for administrative and QA/UR claims. So if we go to the next slide, before we get into the content, we'd love to get a sense of where everyone is starting from. So please scan this QR code if you've got a phone on you, or Patrick just put the link in the chat to join a short trivia activity. It'll just take a minute or two, and don't worry, we're not recording anyone's results here. It's anonymous. So, don't be afraid to answer the questions. We just want to start off with a little fun activity. All right. So Naomi, do you want to pull up the Slido? Amazing. All right. So question 1, this is a true or false, but counties can receive federal reimbursement for the time staff spend on administrative tasks like credentialing providers, tracking grievances, and maintaining compliance with DHCS requirements. So we'll give you all a second to answer. All right, let's show the results. Awesome. So this one, majority of y'all got, this is true, and this is worth pausing on. So admin and QA/UR functions are not back office afterthoughts. The credentialing that ensures clients see qualified providers, the grievance processes that protect clients' rights, and the quality reviews that catch documentation gaps before they become compliance issues. This is the infrastructure that makes high quality behavioral health care possible, and it is recognized, which is why these activities are reimbursable. And so counties doing this work well are not just drawing down FFP, which is a great focus of today's chat, but they are also running better, safer, and more accountable systems for the clients they serve. So today is about making sure that work is being captured and claimed at the level it deserves. Go to our next one here, and we got a total of 4. So the second one is another true or false that QA/UR claiming has a cap, just like admin claiming does. So we'll give it a second or two. And I see some familiar names and faces here, so feel free to turn on camera if you want. Okay, let's see the results. Okay. Again, you guys, majority of us got it. The answer is false. And I think this does surprise some folks. So, almost a third of us were surprised by this, but admin is capped at the lower of 15% of approved claims for Medicaid and 10% for MCHIP, or the actual administrative costs across Medicaid and MCHIP. So while QAUR actually has no cap at all. We'll get into this a bit more later in the slides, but every dollar of allowable QAUR costs you can identify and document is fully claimable. And that asymmetry is one reason why QAUR is often an attractive starting point for counties as they undergo this claiming journey. All right. Question 3 for QAUR activities performed by licensed staff, what is the federal match rate? We've got 50%, 65%, 75%, or 90%. All right, let's see the results. All right, so this one is a tricky one. The answer is actually C, 75%, and that's the rate for licensed or skilled professional medical personnel, so SPMP for short. And it's one of the highest federal match rates available to counties. So licensed supervisors or licensed QI managers, anyone with a professional license doing chart audits, PIPs, or documentation review, you get 75 cents back in FFP for every dollar spent. And for non-licensed staff performing allowable QAUR activities, the match rate is 50%. So that's probably why we got a lot of 50% responses here, which is still a meaningful return and worth capturing. So most counties have staff at both levels doing this work every single day. And so it's an important thing to take note of when you're going through this claiming process. All right, last one. How often do counties submit admin and QAUR claims? We've got monthly, quarterly, annually, or it varies. All right, let's see the results. All right. I feel like when people put in it varies, I always want to pick it because I'm like, there's some catch, but you guys are right with B quarterly. And this matters more than people realize. It's not just a artificial timeline. It's really important because it means that if you can identify and fix a gap in your claiming practices today, you could see that additional FFP in your very next submission, so next quarter. So this isn't something like a multi-year improvement project. The return is really fast on this. That said, it's also important to note that admin and QAUR claiming includes an end-of-year reconciliation process. So annual forms are submitted to true up or true down quarterly claims based on any outstanding amount. So while the quarterly cadence gives you that fast feedback on improvements, that annual reconciliation is where everything gets finalized and outstanding claims are settled. Great. So thank you all for being active participants. We'll flip back to the slides and we'll get into a bit more of this, but based on the results, it seems like we've got a lot of folks here who know a lot about QAUR and admin claiming, but then we also have people on the line who are maybe starting from a different point. But why did counties prioritize this topic with the BCG collaboration team? And the short answer is that counties are already doing this work. So they're already doing this work, but they're not just getting reimbursed for it quite yet. And so admin and QAUR claiming is one of the more meaningful but consistently unrealized sources of federal funding available to county MHPs. So many counties have misconceptions about time study requirements, or they find the guidance complex enough that they've never fully optimized their claiming. And the result is that real reimbursement dollars go unclaimed each quarter. And so what makes this particularly compelling too is also the speed of return. So because claims are submitted quarterly, improvements to your claiming practices can show up in your very next submission. So like I just mentioned in the trivia, this isn't, a multi-year initiative. It's an opportunity to start drawing down additional FFP within the current fiscal year to sustain and expand the behavioral health services that your communities depend on. So moving on to the next slide, we like to start here just to ground everyone in the landscape and kind of take a step back. So counties receive behavioral health funding from multiple streams. You've got 1991 and 2011 realignment. You have federal block grants, BHSA funds, Medi-Cal SMHS, DMC, and DMC ODS, and then also local sources like county general funds. So want to recognize, this landscape is big and each stream, funding stream has its designated purpose and rules. And today we're focused specifically on that Medi-Cal SMHS and DMC ODS stream, because this is where the pathways through which admin and QAUR claiming occurs and where that FFP drawdown opportunity sits. And so within those Medi-Cal funding streams, there are also 3 distinct cost objectives, each billed differently. So first is clinical services, which I think a lot of us, probably think about first. And these are things like targeted case management, individual therapy. They're fee for schedule encounters submitted on a rolling basis. They're reimbursed at the FMAP based on the client's aid code. And so this is one that I think a lot of us are familiar with and probably default to thinking about first. But then we also have second, this administration bucket. And this covers, program management, budgeting, IT, EHR support, contracts, HR training, executive leadership. And these are submitted, like I said, on a quarterly basis, and are limited to, it does have a claiming cap limited to 15% of approved Medicaid claims, or 10% for MCHIP, depending on the program or the actual cost. So you take the lower of the two, which we'll get into a bit further on other slides, but an important note here on that middle bucket for administrative costs. And then finally, the third is QAUR. So this is, activities such as chart audits, documentation review, performance monitoring, corrective action plan tracking. And these are also quarterly cost-based claims, but they have no cap. But even though they have no cap, every cost identified must be allowable with a high degree of accuracy as well. So we're all about high integrity, high fidelity claiming when it comes to QAUR. And then let's go one level deeper. So we're kind of like peeling back the onion here. But within admin and QAUR, so those on the last slide, those last 2 buckets, within those, you're capturing both direct costs. So these are costs associated with specific admin or QAUR activities like staff salaries for roles and time spent on managing information systems or quality improvement. But then you also have indirect costs, which benefit multiple functions simultaneously. So, this could be like a facility that supports both direct costs, direct services, and administrative work. And once you've identified your allowable activities, there's 2 steps that you really need to take. First, you allocate those indirect costs across your MHP, admin, QAUR, and direct services. So like I said, that facility that serves a purpose across all of them, you first need to allocate those indirect costs. And then you need to apportion the costs across Medicaid, MCHIP, and non-Medicaid programs to ensure we're identifying what dollars are actually going to draw down FFP. And then just to note here, you'll get these materials, and we have everything hyperlinked. And so you'll see in the upper left-hand corner here, bin 21027 is the detail guidance. And so everyone should definitely take a read of that. But this is kind of the summary view to break down all of that guidance into a few tactical steps for counties. Okay, so moving on to the next one, let's talk a bit about structure. So there are 4 claiming pathways for admin and QAUR. And you'll see there's 4 corresponding forms with each of these pathways. So we have the MC 1982B and MC 1982C on the SMHS side. We've also got MC 5312 and MC 5311 on the DMC ODS side. And admin and QAUR have different FMAP rates and claiming caps. So why we kind of show this in 4 quadrants is because where you start, to focus on claiming matters for you financially, because there are a little bit different calculations for your financial return. But the good news is on the right-hand side here, the approach to strengthening claiming is consistent across all 4 pathways. So yes, you'll pick a pathway to start, but when you get there, there's really 4 key steps that you would follow. The first being reviewing the guidance to understand what's allowable versus not, then sitting down with a specific group to start with to map the activities they do to the allowable versus not allowable buckets, and then implementing this and supporting and designing. So kind of that change management sticks for people claiming. But like I said, before you kind of start those 4 steps, there's a step 0, which is selecting your starting pathway, which is what this next slide goes into. So step 0 is about making a smart, pragmatic choice on where to start. So you want to evaluate each pathway on 2 dimensions: the estimated FFP uplift, so the dollars that will come through the door on this, but then also feasibility and speed to impact, meaning how hard is this actually to implement, and is it going to be feasible for our county at this point in time? So on the admin side, to calculate the FFP uplift, the calculation is relatively straightforward. So you think about this as first you calculate the claimable amount, which is either the lower of the 15% of approved Medicaid claims or your actual administrative costs. And so to estimate the uplift here, you'd compare what you're currently claiming to that cap to see what additional FFP uplift that you could claim for on the admin side. But on the QAUR side, since there is no cap, there are kind of 2 approaches here that we recommend. The first, it could be called a best performer analysis. So you could look at the time currently being recorded by role against QAUR activities, and you can identify folks who are claiming, in your head, the right amount, and then you could calculate the uplift of what it would be if each role then performed to that person. Or the second approach here, which we've done with the county, is kind of a supervisor poll. So asking supervisors what they believe, the ideal QAUR time allocation as a percentage of overall time should be based on knowing the activities that their team does, and then comparing that to what's actually being recorded, and the gap there would be your uplift estimate. And so both approaches here give you kind of a grounded, defensible number to work with before you commit to a pathway. And so you'll see on the right-hand side, you'll come to 4 FFP uplift estimates across these 4 quadrants. But then the other thing we want you to weigh here is don't just go where the biggest dollar amount is right away. You also want to factor in feasibility, which includes data availability, quality, complexity of operational changes required, staff readiness for time studying. We've seen this in counties. Sometimes certain teams are undergoing changes, so it's not the best time to attack that. And then also existing financial infrastructure. So we know, everyone on the back end has different, maybe IOs or ways that they have set up their financial infrastructure. And so if that's not ready to kind of be taken to the next level, it may not be the best time. So our recommendation is, prioritize the balance of value and speed and start with one pathway. But another call out here is just don't spend months trying to find the perfect starting point. We call this don't admire the problem for too long. It's better to just get started. But if you wanted to be strategic about it, this is one way that you could think about it. And getting started somewhere is more important than optimizing the starting choice, in our opinion. And so this next slide is kind of the heart of today's session. So once you've selected that pathway, you move through these 4 steps. And so bear with me, I've got a lot of, best practices behind these 4 steps to speak about on this slide, but I'll take you all through it a bit slowly. So the first is reviewing the bin guidance. So start by thoroughly reviewing, bin 21027 and its corresponding references, especially, that Exhibit A that if you all have read this guidance before, you're probably very familiar with it. And this is your authoritative source for understanding what activities are actually allowable for admin and QAUR reimbursement. And a few things to be deliberate about here. First, we would recommend focusing on direct personnel costs, since people-related expenses are typically representative of the largest reimbursement opportunity and would have the greatest financial impact, meaning, handle potentially those indirect costs second here. And then second, a best practice we learned is engage with cross-functional stakeholders early. So what this looks like is bringing in, someone from the QI team, compliance, fiscal representatives to share, kind of like create a shared definition of what allowable activities are and a clear distinction between what direct and indirect costs will be, and then alignment with your financial infrastructure requirements. And as you classify expenses, document a defensible cost methodology. So clearly articulate the rationale for what you're calling direct versus indirect, and anchor your decisions to DHCS guidance, especially when you hit those gray areas. And so what this tactically looks like when we've worked with counties is, having a list of areas that we think are super clear examples of what's allowable, what's not allowable. And then we have this bucket that's, gray areas. And it's very common that counties will develop a list here. And sometimes you can chip away and figure out if something is allowable versus not. And sometimes things stay in that gray area. And it's very dependent on what happens in the meeting or what's the main activity there. And so that's a bit about best practices we learned with step 1 here. Moving on to step 2, this is mapping activities. So in collaboration with your staff, you want to map activities to allowable or not allowable for admin and QA/UR reimbursement. So this is where having those cross-functional stakeholders already engaged pays off. You're not just, doing this from the fiscal team or finance perspective. You need the program staff there who can explain what they do actually day to day. And you really drill down into, we've done this recently with a county where, certain types of meetings, folks said, I attend meetings. And it's like, okay, that's a great activity. We need to get into the detail of what is discussed at that meeting. Is it truly a QA/UR discussion, or is it not? And that is kind of, at the end of the day, the definition that you want to get down to for each activity. And so for activities that maybe overlap with other cost objectives, you want to standardize your claiming decisions and be consistent. So select a single approach and formally document this rationale. And I just want to call out here that Cal Mesa's Behavioral Health Fiscal Academy is a really useful starting point for both steps 1 and 2 here, which are big steps and, sometimes prevent counties from even getting started in the first place. So recommend really leveraging that resource as a starting point when you tackle steps 1 and 2. But moving on to step 3, this is when you're going to actually implement the changes. So this includes, you want to update county policies to reflect allowable admin and QA/UR activities. And then you also want to develop role-specific guidance to support accurate time capture and change management. And this step is fundamentally about staff understanding and buying in. So, it's great if one group decides what's allowable versus not, but you really need to clearly explain what admin and QA/UR claiming is and why FFP drawdown matters to the county mental health plan. So staff need to understand the purpose behind accurate time capture to feel motivated to participate. So like I said, these materials will be shared in that upfront section of how to define administrative and QA/UR activity or claiming, can be a helpful resource as you get buy-in across the whole behavioral health department. But you also want to start your training with managers and supervisor roles to establish kind of the train the trainer model. So this is really enabling leadership first, so then they can help reinforce expectations to frontline staff. And you enter those working sessions with a defined view of what's allowable activities, but remain open to those gray areas that emerge and engage in discussions and use that feedback to strengthen your county guidance and foster a two-way communication between the clinical and the administrative staff as the practice evolves. And then step 4 here, you want to provide continuous quality checks to track progress and design or redesign back-end processes to ensure claimable expenses and activities are claimed quarterly and, reconciled annually with clear supporting documentation. So this is kind of that your infrastructure layer. So the systems, the workflows, accountability mechanisms that make accurate claiming sustainable over time. And then we'll get to the last kind of section that we want to cover today, but we're calling them common pitfalls, but we've seen even counties that are engaged in admin and QA/UR claiming, they often encounter issues that reduce the accuracy or completeness of their FFP drawdown. And so this page outlines a few that we've seen. The first two, I think are around more of the admin claiming. So the first is incorrect application of a denial rate. So we've seen counties, when you have claiming processes that don't evolve over time as guidance evolves, you tend to see certain calculations that are maybe outdated. So we've seen one on the admin side where there was an outdated or artificial assumption driving the calculation. And this was, a higher denial rate baked in from years before any CalAIM changes. And obviously denial rates look different today for that county. And so they were missing out because they were artificially taking out this denial rate before calculating their admin cap. And so our recommendation here, or common watch out, is just don't carry forward old assumptions without verifying that they still reflect reality today. The second one that we've seen is expenses misclassified as non-reimbursable. So the problem here was that, this county had costs that were being misallocated between MCHIP, other SMHS, Medi-Cal, and non-reimbursable buckets. And so the fix was just, supporting them in reallocating those expenses based on the actual beneficiary population data and not just, again, an artificial assumption. The third one was QA/UR time was not accurately captured or sourced. And so this one was a very interesting one. There was misalignment between where QA/UR activity actually happened and where it was being reported. And so what this really manifested to be was a county had some folks recording on a timesheet while others were recording in the EHR. And there was no single source of truth to pull the QA/UR time directly from. And so we recommend, having clear guidance for your staff on where they should be recording this time and what is going to be the source of truth that for claiming we will pull from. And then finally, the last one was, incorrect quarterly claim reporting period. So this was, again, starting off way back, if you remember our trivia in the beginning of the session, that you want to claim quarterly. And this county, I think, misinterpreted that it was year-to-date expenditures instead of single quarter expenditures. And so the fix is really ensure you're pulling quarterly reports with the correct date parameters, and then you're completing your annual reconciliation at the end of the day. So good news here is, yes, these were things that we've seen in counties, but they're all fixable, and resolving them just doesn't improve just the FFP drawdown. It strengthens, internal processes for high fidelity, high integrity claims going forward. So we've got about 15 minutes left for Q&A. But before we get there, we want everyone to scan this QR code. And Patrick will put a link in the chat again, or he already did. And we want to make sure that everyone gets a chance to fill out this survey. So feel free to take a minute to do that. And while you're at it, if you have any questions, throw them in the chat and we'll answer them. So I'll give a minute or two for folks to fill out that survey. And if you're new to Zoom, there is an option to send, direct messages. So if you don't want your question being linked to your name or anything, you can feel free to send it directly to Patrick, Naomi, or myself, and we're happy to answer it anonymously. But while you guys are maybe filling out that survey, I did prepare a few questions that we've heard from counties as we've undergone this process that may be top of mind for you all. So I'll cover those, but please, again, we'll prioritize any questions from the audience today.
One, Lucy, we
Yeah.
have come in here. For a smaller county with limited fiscal and/or QI staff, what is a realistic first step or a good place to start?
Yeah. And we've worked with smaller counties. So what this looked like was starting with a very focused working session. So just 2 to 3 hours with your QI lead and fiscal representative is a great starting point. And what you do in those 2 to 3 hours is sit down, a lot of folks print out that bin 21027 and review the guidance, and then think about those high volume activities that roles do and try to map them yourself. And you don't need to boil the ocean, but pick one pathway, identify the 5 to 10 roles that are most likely doing this allowable work that you've brainstormed in this small group, and then you can develop simple role specific guidance. So again, without having all of the roles in the room, because you're, working with a leaner team, you'll at least cover some of those high volume tasks that roles do. You won't hit all of them, but it's a great starting point to start chipping away at claiming. And then again, Cal Mesa's BH Fiscal Academy materials are a strong starting point and can significantly reduce the risk for a smaller county. But realistically, if a smaller county can just get claims going in the first quarter, that's progress at the end of the day. So it's definitely easy to just start chipping away at. I think I see a hand raised. Ryan, do you have a question?
Yeah. Hi. Thank you. Ryan Caceres. I'm the Director of Behavioral Health Financing with Cal Mesa. Thank you so much for the call out to the Fiscal Academy. Really appreciate it. And the materials that were presented here today were phenomenal. One of the things I wanted to add to the answer here is that something that may also be an opportunity for like really low hanging fruit, easy to claim, would be looking at your contracts. So if you've got, let's say, a contracted service provider that's only performing your inpatient psychiatric concurrent reviews, then there's no time study necessary. There's no additional thought work. It's just, let me get the claim form, let me put the cost that I paid to that contractor on it, and that's one check in the box.
Thank you for adding that. That is super helpful. And that's something we've also seen is folks asking or having a misconception about some of the time studies. And I think a lot of folks bring up MHMA when we're talking about this topic too. And we know MHMA requires, more strenuous time tracking, so minute by minute on an ongoing basis, which can really be burdensome to folks. And so I think admin and QA/UR claiming is much more straightforward, where staff can allocate their time across cost objectives on a quarterly basis, typically through just their timesheets or EHR activity code. So I totally agree that that's a great starting point. And thank you for that ad.
Yeah, absolutely. And if I can add just one other thing. So one of the things in the context of claiming for administration, I think that a lot of counties may find themselves in a position where they have all of their administrative costs to run their entire plan sort of pooled up into a single cost accounting unit. And so the challenge there may be when they're thinking about putting all their administrative costs onto the 1982 B form is, do I just put all of my administration time or costs? And one of the things to be careful about is that there's likely a lot of administration efforts going towards non-Medicaid allowable activities, such as IMD placements and things of that nature. And so, it's just important for the counties to allocate their administrative costs towards Medi-Cal objectives, and then have those be the costs that they're putting onto the claim form that then are used basically at that lesser of cap, right? Either the claim total within the period or those eligible Medicaid specific administrative costs that happened in the quarter.
Yeah, that's completely right. Thank you for all these ads.
Yeah.
Maybe kind of building on that, I had a question come in here, Lucy, on how would you recommend counties prioritize between admin and QA/UR if they're starting from scratch? Like, is one faster and or easier to implement? Don't know if you have any perspectives there, but yeah, that was one that came through.
Yeah, that's a great question. And it's probably an answer everyone hates getting of like, it depends, but it really depends on the county starting point. So generally, we recommend evaluating both pathways early and then picking the one with the best, combination of uplift potential and feasibility. Again, it depends, but QAUR is often attractive because there is no cap on claimable costs. And then also when you add in that 75% FMAP for licensed staff, it's a strong return too. However, the flip side of that, we've seen counties focus on admin because it can sometimes move faster in counties that already have that strong cost center infrastructure. So the most important thing though, I'd say regardless, is just get started. Like it's less important to pick the perfect pathway, than, just pick one and start to build from there as well. Awesome. I don't see any more questions. I can acknowledge one. So I know I brought up, the time study of MHMA. Another term I think that people who are newer to this claiming that throw around are, Prop 30 and how should I think about Prop 30? Is it a separate process or is it layered on top? And it is layered on top, and Prop 30 doesn't replace or change your admin and QAUR process. So we don't have materials saying like, now you need to do all these other things that are different for Prop 30. But once it's like an additional funding layer is how we think about it for specific state and federal mandated activities. So once you've identified activities that qualify as Prop 30 eligible, you can claim them through the same admin and QAUR forms using the designated line item on them. And the key distinction here is between state mandates where Prop 30 will cover 100% of the non-federal share, and then versus federal mandates, where Prop 30 covers 50%. And so our recommendation is, get your baseline admin and QAR claiming solid first, and then focus on, layering in Prop 30, seeing if you're missing out on anything there. But we found counties who are trying to do all of this at once have a ton of change fatigue. And, it's really important to, if you can capture the uplift that remains from admin or QAUR, that's going to significantly impact your FFP drawdown. And so kind of taking it bit by bit is really important. I think Raven, you got your hand raised.
Yes. Hi, all. With CBHDA, Raven Lopez. Just wanted to, again, appreciate the webinar that you all have today. Because you mentioned Prop 30, my ear, of course, perked up for a minute here. And I just wanted to flag that the admin form or the QAUR forms are not the only way to pull down Prop $30. A lot of times there are aid codes that are in the short-bill Medi-Cal billing system. So when you do your Medi-Cal billing, it automatically knows that that is a Prop 30 claim, and that the state general fund share, whatever percentage that is, automatically applies when you're getting your reimbursement back. So just wanted to flag that there's various ways that Prop 30 can occur. So just wanted to make sure that people understood it's not just through the admin or the QAUR form. There's other mechanisms as well.
Yes, thank you for raising that too, because I know our materials are focused on the 4 quadrants and the 4 forms, but there is the world outside of that exists for Prop 30, and it's important for counties to be utilizing all of the resources they can to be able to claim. Any other questions before we wrap? And again, maybe if we can go back a slide, just please fill out this survey if you didn't have a chance yet. The survey link is in the chat too. You can also leave additional questions and we can follow up through that survey. So if you have more detailed questions or very county specific things, feel free to put it in that survey and we will definitely follow up. And again, we will share out these materials in the recording. But thank you all for your time and engagement today. Again, if you have any questions, if you flip to 2 more slides, we've got 2 folks' emails here. For any information on the FFP collaboration team model, you can reach out to Patrick Pearson, who's on this call, and his email is listed there. And then for more information on policy related questions, Teresa is also a great resource to reach out. But thank you all for the time today. And thank you, Ryan and Raven, for adding to the conversation as well.